welcome to Tipsy Tooth Talk. I'm Dr. Carolyn Palmer Blume.
And I'm Dr. Michelle Bishop, and I call it T-Cubed because I usually can't say it.
Well, but after the hiatus, I guess you got a little break and you're ready to talk.
I know, it's been a hot minute since we've been here, y'all. Sorry, we took a little bit, almost like...
It's been like a month.
It's been like a month, like a European, like they take their month off over the summer. So...
That was us. I went to Spain.
Yeah.
And she's getting ready to travel.
I am. I'm leaving, oh my gosh, like a week and a half. I gotta start packing. Week and a half going to London and Paris. So exciting.
I was fortunate that ours was a gift from my mom because my daughter graduated from high school, y'all. So we're getting ready to send her off to college, and so we did a little bit of traveling first. So today we're actually gonna make a travel-inspired drink from my trip called the Agua Valencia, and then we're going to talk about
antibiotic prophylaxis before dental work. In other words, do you have to take an antibiotic before you have any dental work done? And we'll talk about why and when.
And I think that on your travels, you should pick up some drinks.
Oh, no
that
worries.
we're going to make when you get back.
No worries.
And then we have some friends, moving around the country and stuff, and maybe we can get them to send us some drink ideas. So that would be great. So anyway, well, let's get started.
All right, and Valencia, that's where you were in Spain, right?
We went to Valencia, Barcelona, and Madrid.
Nice.
And Valencia was our first stop. My parents' next door neighbors have a place there. She grew up there. And so that's kind of what inspired that as the trip. And it was lovely. And I had such a nice time with my daughter because when everybody else would get tired, she and I would go to these great little, I don't want to call them bars because they weren't really bars, but these great little
tapas bars or
kind of,
little cafes that stay open late.
And they had this amazing drink called Agua Valencia, and it was really unique to Valencia. Like, you could order it other places, but everywhere in Valencia had it.
Okay.
And I did the HEB orange juice instead of the fresh squeezed Valencia orange juice. Although HEB did have some Valencia oranges, so I did get those for the garnish, but I wasn't going to juice 500 mils of Valencia oranges.
Okay.
So anyway, so that's what we're doing. That's what we're making today. And so it starts with 500 mils of orange juice, which is a little over 16. Which is a little over 16 ounces. I squeezed it and it went everywhere.
There you go.
Thank you. So if you want to pour that here.
HEB to the rescue yet again. All right, look, this actually has
Mills.
on it.
Nice.
It's just such a, this is all fresh squeezed orange juice, y'all. If you have an HEB nearby, you know that you can get this in this size, or you can get like
Smaller
your
sizes.
smaller own little personal size, like I usually have.
And they're yummy, yummy.
It's so good. Growing up in the Valley, I grew up in the Valley of Texas, we always had fresh orange juice. Does this go in the pitcher?
It does.
Okay. I'll try not to splash. Oh, wow.
Like I would.
Wow. Okay.
And then it is 300 mils of cava. So cava is sparkling wine from Spain. So, Italy is Prosecco, France is Champagne.
I didn't know that.
United States is sparkling wine.
Right.
Spain is cava.
Did not know.
So I went ahead and instead of using a Prosecco I already had, I got an actual cava.
Thank you.
And we do 300 mils of that.
That's a pretty bottle too.
Isn't that gorgeous?
Like, that's lovely.
I think I had a bottle of that years ago that I used as a candle.
I could see, keeping this afterwards and having it. I'm trying to pour slow, so.
It's said to use a semi-sweet, and HEB had less sweet, less sweet and more sweet. It didn't really have semi-sweet, so I just picked the one with the prettiest bottle, and I knew I had had it before.
Okay.
So now it's 100 mils of vodka.
Oh, okay. Cheers. Okay. Well, I'm gonna need a bigger pitcher if we keep going.
You're almost done.
Okay.
And 100 mils of gin. Now, the gin I have is kind of an earthy, like botanical gin.
Okay.
It's not just a plain gin. I don't know how that's gonna affect the taste, but I actually like this gin.
Okay.
It's called Gray Whale Gin. I think it's pretty yummy and like a gin and tonic.
Nice.
So that's what I have.
I like it.
It's pretty good.
Okay, 100 you said, right? Okay.
Okay. And
Looks
then,
like a whale of a good time. I had to. I couldn't resist.
and then some people say to put Cointreau in it. Now, when I read up on it, most of the places in Valencia don't put this in there.
Okay.
And the person who is credited with originating the drink doesn't use it. But I did want to throw it out there as something that adds what they say is this can be a little, depending on your oranges, it may or may not be sweet enough. And so this is, gives a little orange flavor and a little bit of sweetness, or simple syrup could be added.
Okay.
But this was the way, the recipe was written,
Okay.
and the way most of the people in Valencia make it.
Nice.
So then we can throw in some oranges to make it pretty.
Nice. Okay.
And do we have
Oh,
something
we
we
have
can stir it with?
Sorry, hang on. Put it back in a flash. I have my
Okay.
handy stirrer.
They always have oranges in it. And it looks to me like in Valencia, they do it kind of like a sangria where they let the fruit, they put a lot of fruit in it and they let it sit for a while.
Okay.
So I think that if you were making it for a party, you might want to consider that.
Okay.
And then we just pour it over ice.
Okay. Hang on. I'm making a mess everywhere. I'm trying to keep the ice back. I don't even know why we're letting me pour. We know I don't pour
I don't either.
evenly.
Oh, I pour evenly, but I make a mess.
All right.
Okay?
There's that.
And then get your little garnish.
Okay. Nice. Got a little straw.
All right. Cheers to beautiful smiles.
We should have learned that in Spanish for Spain.
Oh, we should have. Salud.
Salud a sonrisas hermosas. Boom!
Salud a sonrisas hermosas.
Look at that. Ha! Someone's gonna send me a DM that says that's not right.
Hey, we tried.
We tried.
My kids made fun of me for the way I said gracias the whole time we were there.
Really?
Yeah.
At least you were saying it.
Exactly. I'm like, when people come to the United States and say thank you, if they say it in a funny accent, I just appreciate that I understood what they said.
Or they even said it.
But they were like, no, it's not gracias, it's gracias. And then I'm like, gracias? No, not ass, ass. Gracias. Gracias. Gracias.
Gracias.
We fought about it at every single time somebody brought me something in Spain and I said gracias, they were like,
Did you roll your R? Gracias.
no, but I did get the TH for Barcelona.
It just kind of sounded like you had a lisp.
Well, apparently one of the kings way back when had a lisp and wanted everybody to say it the way he said it. So they say Barcelona and Valencia. And I'm not kidding you. I'll ask my mom. I'm not kidding you. It was more in Barcelona and Valencia, not so much.
Carol, you're going to have to call me. You're going to need some verification of this.
Well, it's her neighbor, Anna. We'll ask her.
Okay, Anna.
Okay.
Because I can't even do it.
Yeah.
Barcelona.
Yeah.
It doesn't work for me.
It's only in those regions. It's not in, Madrid and stuff like that. It was interesting. And the Spanish was so different from place to place, too.
Oh, yeah, I've heard that.
Yeah. Clara could comprehend in Valencia, but couldn't really speak.
Oh.
She was like, Barcelona, y'all are all on your own. I have no idea what's going on. And then in Madrid, she was able to actually communicate, which was great because that's where we found the least number of English speakers. And so
In Madrid?
don't
Go
know if
figure.
it's where we stayed in an Airbnb, so maybe it's because we were in a residential area.
Oh, okay.
I don't know, but
Kind of off the
she
tourist
like
thing.
helped us order, and she did great in Madrid. But
Wow.
yeah, we'll have to talk to Senor Archer about that. She couldn't hang in Barcelona and
Well,
Valencia.
yes. Before I take mine to Spain. Oh, you like tripped
Yeah.
all over our topic.
We know it. We've been doing this for 23 years.
Yeah. Senor Archer will have to.
Get us ready.
I'll have to ask him before I take Reagan to Spain. But no need to worry. Right now we're trying to practice our high school French in this household, which for some of us in this household has been well over 30 plus years. Just saying. So, all right. Well, antibiotics and dental treatment. I feel like, I don't know how much in pediatrics you guys deal with this on a daily basis, but if you're in a practice like mine where the median age is over the age of 35, 40, somebody on a daily basis has had a joint replacement or has heart issues or has a whole host of health issues, and so we're always talking about this.
I'd say we deal with it 2 or 3 times a week.
Okay, I probably deal with it 2 or 3 times a day.
Yeah.
So, for me, the frustrating part is the medical side can't make up their mind.
Mm-hmm.
I'm just going to say that. They can't make up their minds. They change their guidelines every few years. They tell their patients one thing, they tell us another thing on the phone. It's just super frustrating. I love all my MD friends. Don't call me. Don't send me any hate mail. I love you guys. Just make up your minds.
Well, I think so much of it is a litigious situation.
Yes.
I'd rather say cover it,
Yes.
because you really can't prove antibiotic resistance.
Right.
But if you get an infection from something that you could have covered, I think that's where it comes
Right. So, yeah, it basically all comes down to lawsuits.
from.
And so
CYA people, CYA.
yeah, so what I find is they'll tell the patient, no, you don't need anything, but then if I make a phone call, they're like, well, you know what, go ahead. And I think it goes back to that CYA. But, so we were talking about this earlier. I find it's a pretty quick topic in my office because really the only thing we are pre-medicated, let's talk pre-medication, what that is anyway. If you used to have like a heart murmur or a heart problem or a joint replacement, we gave you antibiotics 1 hour prior to your dental appointment. So we would write you a script, you would take that to your pharmacy. If your appointment was 9 o'clock in the morning, then at 8 o'clock in the morning, you were taking these antibiotics before you came in to see us. So that's what we mean by antibiotic prophylaxis. I can't believe I can
Do
say
you
that
remember
word.
that show that Jimmy Smits used to be on? One of the police, he was on LA Law. He's a really famous actor, but it was the the show that he was on about police officers. Anyway, somebody in that show died from endocarditis from a dental treatment.
Of course they did.
Yeah. So if you saw that, you know what I'm talking about. This is what we're talking about.
Okay. Feel free to pour yourself some more
Okay.
along the way there. These are small glasses. Why didn't you tell me to get the bigger ones?
I don't know.
I have bigger ones. It's tiny pour.
You want me to
Anyway,
go get them?
no, it's fine. Whatever. Just pour more. Okay, so that's what we mean by antibiotic prophylaxis. You would have to take it 1 hour prior. So it used to be if you had a heart murmur, for instance, I have a heart murmur, and then it went from if you have a heart murmur only with regurgitation. Well, I have that too. And then now the American Heart Association has made it super simple for us. And here's what I say to my patients all the time. There goes my dog growling at me. Here's what I say. Mrs. Jones, have you had your chest cracked open and had open heart surgery to have something replaced? Or have they shoved something up your leg all the way up to your heart to replace something? No, we're good. We're good. You don't need, that's for heart patients. We don't need antibiotic prophylaxis. It really is people that have had open heart surgery, have valve replacement, different types of shunts placed, but only certain types of shunts, not all shunts.
And only within certain periods after the surgery. Sometimes pacemakers you get.
Yeah. even then,
replacing something.
yeah. So now really the question here's, because I feel like if I say to my patient, I mean, are you kidding me? Shush
Holly.
it. Holly.
Quiet.
Here's what I say to my patients. Or the dog some too. Good Lord. Do you have a scar on your chest where they have gone into you and replaced something? Yes or no? Right? Yes, then we're going to talk about it more. No, go ahead and pour me some. I'm going to mute it. Right? No, then we're good. Have they gone up your leg with something, not to balloon open a clogged artery or anything, but gone up your leg with something artificial to replace something? Nope, we're good. Right? I don't want to see the scars. But I want to know if you have the scar. If you have the scar, then we need to have a further conversation. I may have to call a doctor and just get a consult. So that's how easy I keep it and how simple I keep it, because if I start trying to throw out terms, people are like, well, I don't know what I had done. A lot of people don't even know what they had done. But so that's heart. I'm going to back up a little bit. Or if your doctor says you have something we cannot repair, some congenital heart disease problems that they would like to go in and repair, but they cannot, then we need to have a conversation with your doctor.
And just a real quick aside, what we're trying to prevent is the same bacteria that are in high volume in your mouth are bacteria that really do affect the valves of your heart. They tend to collect there, and they tend to multiply there. It's a target organ for them. Mm-hmm. And so when we do something that makes your gums bleed, that bacteria that is in high volumes in your mouth gets into your bloodstream and just lickety split goes straight for your heart. And so what we're trying to do with this medication is decrease the number of bacteria in your system, so that when we make your gums bleed, because let's face it, a lot of the time when you get dental work, even a cleaning done, your gums bleed.
Right.
That's what we're trying to prevent. And some of the reason the guidelines have changed that she's going to talk about some more is a lot of your gums bleed when you brush and floss, right?
On your own.
And nobody's going to tell you not to do that because you might die from a heart problem. So they've tried to make it a little more reasonable and say, some of these problems that yes, you might have, it's called endocarditis.
Mm-hmm.
Some of these problems, like the regurgitation that she talks about, yes, it's a little bit higher risk, but it's not a higher risk than brushing and flossing.
Right.
And so, so that's why it's changed so much over time, and that's what we're trying to prevent.
Right. So, heart patients, I have that quick conversation with them. No scar, and no congenital heart disease that they're aware of that they see a cardiologist for. Then we're good. Joint replacements. This, honestly, it might even be more than 2 to 3 times a day that we talk about this.
I don't talk about this.
Not getting a pin in a broken bone, not getting a screw in a broken bone, but having your entire joint replaced. So people that have hip replacements or knee replacements, the guidelines on that has changed as well. It used to be that you had to have antibiotics before dental procedures for a lifetime. Then it went to 2 years, and now they don't even usually recommend that anymore. It really depends surgeon to surgeon. So when I'm fortunate enough to already have a patient that knows that they're going to have a joint replacement, and they're actually coming in, that surgeon is saying, will you please give us a clearance for them to have surgery, thankfully, then I say, please have that conversation with your surgeon, whether or not you can have dental work within a certain time. The average is, if you're having a complete joint replacement, they're not going in and scraping anything, they're not going in and it's not like an ACL tear, they're completely replacing your joint. But the average is they really don't want you to have anything done 3 months after surgery. And then after that, it's usually no problem. They're not really requiring antibiotics anymore. So that's good. But I will say that really does vary surgeon to surgeon, is what I found. And so when I have people that have had something done and I say, did your surgeon talk to you about this at all? No. okay, let me make a quick call. Let me just find out what their guideline is, because what it comes down to, and patients get really frustrated with this, but what I want you to understand is we're doing it for your best interest. I'm not trying to cancel your appointment. I don't want a hole in my schedule. People think, well, you just don't want to see me. No, I want to see you. I don't want to have a cancellation on my schedule. Trust me.
I need to pay my hygienist.
Yeah, my hygienist's going to get paid whether she sees you or not. I'd really like her to see you. But it really is just for your own good. I mean, we're just trying to prevent. You went through, and what I tell people is, you went through so much for that joint replacement. Why would you want to risk something happening to it? Let me make a 5-minute call. Just give me that grace to make that 5-minute call and make sure we're good. Because here's the other thing. I keep antibiotics in my office. And if you need antibiotics and your surgeon hasn't told you and we haven't already, we're not going to reschedule you. We're just going to give them to you in the office. Because the studies show as long as you take it within 2 hours of the procedure, you're good. So I give them to you right there. You take them. We keep moving along. It's just it's about a 5 to 10 minute delay.
And what I do is call it in, and when they leave my office, they go get it. And I just call the pharmacy and make sure it's ready.
So,
because in peds we do liquid. You know how many of my kids are going to swallow a pill? Not very many, and liquids go bad very quickly.
That's true.
So we just write the script and tell them to go straight to the pharmacy. Do not pass go. We call the pharmacy and tell them to have it ready.
Okay. So we just keep the bottle of pills. If you're allergic to penicillin, I have the extra. I have it all for you. So, so heart. There's no scar or no congenital defects, no antibiotics. Joint replacement, we're just going to have a conversation. We're going to find out how long ago you had it done. And the only caveat to that is that some surgeons will say, if there was a problem in healing or you had recurrent infection after, then they may want you to pre-medicate. And that's the whole point of the phone call. But I'll have that conversation with the patient, like, hey, how did you heal? How was the recovery process? Oh, it was no big deal. I was up and walking within 24 hours, and then I went through rehab, and I haven't had a problem since. Great, we're good. Oh no, I got sent to rehab, and then they had to go back in because it was oozing, or whatever. Then I'm like, yeah, I think we should call your surgeon and just make sure all is good to go. So,
you know what this makes me think of is, how many times do you have people that get frustrated with the medical history? Like filling out the medical history, and they're like, you don't need to know this. What is, so for those of you out there listening to this is why we ask. Your mouth is part of your whole system, and it's all connected, and it all affects each other.
And the mouth is the portal of the body, like everything that goes in, right?
Yeah, passes through your whole system.
Yes.
So next time you're sitting in the dental office filling out the tablet or the paper or however your office does it, and you're like, oh, why are they asking me about this? Even all kinds of medicines, even psychiatric medicines have oral side effects. And so stop getting mad at us for asking all those personal questions.
Yes. We're not trying to be in your business. We're just trying to help you take care of your business. That's what I tell people. So we have our heart people, we have our joint replacement people, and then finally our other subset of people, and you probably have, kids that deal with this as well, but things like uncontrolled diabetes. I want to be speaking to the medical doctor about that. Somebody with some autoimmune disease like sickle cell, rheumatoid arthritis, lupus, chronic systemic lupus, things like that. We want to have we just want to have a conversation with your doctor, make sure everything's good. And then really people that are going through cancer therapy, super important. If you're in chemotherapy, we want to know where you're at in your chemo cycle. We want to know if you have a port, and we want to speak to your oncologist to make sure that whether or not they want an antibiotic to protect that port, what your blood cell count is at.
Those of you who have cancer, your ANC is super important to us.
Yes, very. So there's there's about 3 subsets of people that we're looking at, and like I said, that's heart people, joint replacement people, and then people with extenuating medical circumstances. And so that's where we're asking those questions. Things have changed a little bit too as far as the medications. It used to just be penicillin, and if you're allergic to penicillin, then it was clindamycin. Now they've changed that as well. Was it last year they came out with that change?
2021.
2021.
Mhm.
So now instead of clindamycin, we're using either azithromycin or doxycycline.
I have an aside about that, which we're
Yeah.
getting long today.
We are.
We're out of practice. We haven't
I know,
done this in a
sorry.
while. But azithromycin has cardiac
Cardiac.
side effects.
I don't know why they're using that.
And a lot of people don't know that. And it's just not, I think it's becoming more well known, but back when it was prescribed to me, I mean, it, like, I have a little trouble with a high heart rate sometimes, and as we all do, we all have sometimes a racing heart or whatever.
Yeah.
If you experience that a lot, then it can, it messes, yeah. And I mean, I passed out and was out for a while and home alone with my toddlers.
Getting your teeth clean without it probably would have been better.
Yeah.
But
So, you know, if you have a heart issue, you need the prophylaxis because you have a heart issue. It kind of depends, but it tends to be more of a pace issue, like people with racing hearts and things like that.
Right.
It can exacerbate that. So that might mean you need to be a doxycycline.
Right. So the whole takeaway of this is have the conversation with your dentist. If they're asking, it's not because they're trying to delay treatment or avoid anything. They're just trying to look out for the best for you. Be truthful in your medical history so that we can provide the absolute best care. The last thing we want is for you to have an adverse outcome from anything that we do, and especially as something as simple as a cleaning. We certainly don't want you to have a problem from that. So answer the questions. Talk to your medical doctor if you're going through some type of treatment. Say, hey, you know, I've got a cleaning coming up, or I need to go have this filling done. Any issues with that? I love the people that come in and say, oh, I already talked to my doctor. He knows I'm coming today, and he said, you know, all's good. I'm like, woo.
And I say, get it in writing.
So, anyway, the takeaway is this is why we're asking. There are real reasons. We're just not making it up for grins. And we're just trying to protect you and your overall health, because again, the mouth is the portal to the body, and while for so long medicine has disconnected dental from medical, it's all combined. And so start thinking of your mouth as part of the rest of your body, and that's why we're asking. Okay?
Ah,
Okay.
tell me again.
Oh, I gotta think about it.
Salud.
Salud. What did I say?
Sonrisas.
Salud a sonrisas hermosas.
Cheers.
Cheers to beautiful smiles.
Thanks, y'all.
Adios.